So what's the difference? Well, I talked about a little bit earlier when we talked about the pandemic severity index, about a mitigated versus a non-mitigated pandemic. What is that? Well, actually, when you think about a pandemic, and I'm talking worst case scenario now, you get, well, actually in any pandemic, you're going to get a peak. And what that peak is unmanageable, whether it's numbers of daily cases, or whether it's hospital admissions, or whether it's people coming into clinics, whatever it is. That number, it's huge. And that peak is, it's hard to plan for, and it's hard to get to have your resources meet that peak, that particular peak. So when they start putting in mitigation measures, which I'm going to go through in a minute, when they start implementing those types of mitigation measures in general, what it does is it brings down that peak. Those mitigation measures are designed to bring down that peak. But when they bring down that peak, what it ends up doing is extending. It's extending the wave. So even though the peak may be insurmountable, and you want to start to deploy mitigation measures to try to bring it down so you could get it to a manageable level, and make it easier for your resource management people. So what are some of the mitigation measures that can be put out? Well, there are non-pharmaceutical interventions, and there are some pharmaceutical interventions. Non-pharmaceutical interventions include, closing of schools. And again, if schools get closed, what happens? Well, the parents, all kids have parents, generally speaking, and the parents who work, can no longer go to work. So you're starting to affect your workforce population. There's also voluntary isolation, and let me tell you, for those of you who've had influenza in general, voluntary isolation when you're sick, not a problem, because you do not want to go out. Voluntary quarantine, and again, voluntary quarantine is generally used, or would be used, I should say, in a more severe pandemic. And that's when you're asking certain people who actually have been in contact with somebody who has been confirmed sick to stay home. And, either you can care for them, but, just stay out of the general public because they don't want the virus to spread. Canceling of public gatherings, that would be another way, a non-pharmaceutical intervention. Engineering controls, doing more things online, doing more web-based like we're doing now. Instead of bringing everybody together to a certain location for a conference, more web-based type of instruction. Alternate work schedules. If parents have kids and the schools are closed, what you're going to see is alternate work schedules because they want somebody to care for their kids when they're at home. And they try to do some more types of telecommuting or shift work, whereas somebody could always be home for the kids. And another type of non-pharmaceutical intervention would be personal protective equipment, or PPE. The utilization of respirators, N95s, surgical face masks, gloves, etc., those types of PPE during an outbreak of influenza. Antivirals and vaccines. Those would be the pharmaceutical types of interventions that we're going to be talked about when you start deploying those. Antivirals, and I explained how both of them, how antivirals work, and again, they're neuraminidase inhibitors. For this particular 2009 H1N1, the neuraminidase inhibitors work a lot better than an amantadine or amantadine, which are two other types of antivirals that you can use. And then there's the vaccine itself. Currently, what and who should get the vaccine, according to the CDC, because they're looking at priority groups. This pandemic, as everybody stated, is a mild pandemic. And when I say mild pandemic, please remember that it may be the 1918. No offense for you. You may feel like crap, and you could be one of those people that actually have some type of underlying condition that puts you at a higher risk. So when the CDC looked at the underlying risk of certain individuals and who was coming down with the more severe cases, a group emerged. And that's who is supposed to get the vaccine first, most across the country, because the production of the vaccine, because, again, this is a worldwide pandemic, so we, being the United States, aren't the only ones that are looking to get this vaccine. They put a crunch on it because it's also the same time that they were producing the seasonal vaccine. So those vaccine manufacturers have had to do, double duty here. So the CDC is recommending that pregnant women, the first tier group to be pregnant women, people who live with or care for children under the age of 6 months of age, healthcare and emergency medical services personnel, persons between the ages of 6 months to 24 years old, and people the ages of 25 through 64 years of age who are at a higher risk of chronic health disorders or compromised immune systems. Those who should be, are the ones that should be getting the vaccine first. In my state, I'm from Minnesota. Last week, I actually took my kids to get their H1N1 shot. And while I'm standing in line, because yes, everybody stands in line to get their shot, you start to overhear people talking. And one of the things that I heard, the lady in front of me asked me, "Hey, are you getting the shot?" I said, "No, I'm not in the risk group." And she looked at me and said, "Oh, that's okay. They'll give it to anybody." And I kind of said, "Well, I hope not," because this is the group that's supposed to get it first. Each state is at a different spot where they have received vaccine from the CDC. And you may be on your first risk group, so you get it first or initially, and your state may be on the second group or your community. It's not going to be the same across the board. Everybody's at a different spot as far as where they've gotten their allocation of the 2009 H1N1 vaccine. So wherever, check to see if you're eligible to get your shot. This is actually one thing that you can do that will assist you and assist the community, because again, it's a workforce management issue, and it's a novel virus. Nobody has immunity to this one because nobody's body has seen it before.
Annalie, that was fantastic. Thank you again. What a great overview of influenza. I'd like to wrap up this presentation with just a couple of slides about live process and how they can help you manage the H1N1 pandemic, and to provide our contact information if you'd like to get in touch with either Annalie or me. This slide that you're seeing right now is just an introduction to the live process. It explains that we are a comprehensive solution, but I also wanted to share that we've been used in over 1,000 different exercises and actual events. Also, we have a customer base of over 500 unique facilities, healthcare facilities, and public health agencies across the country. We're also the only disaster preparedness and incident command solution endorsed by the American Hospital Association. This slide gives you a few examples of how live process can help you manage H1N1, including how to evaluate the risk of H1N1 for your community or your facility, a common area that is universally accessible to post plans, policies, and procedures. There are specific areas within the platform where you could host all your H1N1 specific exercises, quizzes, after action reports, or any tools. You have an inventory management tool that allows you to track the pharmaceutical and non-pharmaceutical supplies that are available to you. And lastly, we have a built-in notification system that can be used from the internet-based platform or your handheld device for notifying specific folks about maybe potential cases, suspect cases, or even an OSHA or Joint Commission inspection. Finally, here's the contact information for Annalie and myself. We'd love to hear from you if you have questions or comments about this webinar or ideas for additional content we could provide that'd be helpful to you as you deal with the H1N1 at your hospital or healthcare organization. Please feel free to go back to the original slide that talks about where the other webinars are available. And once again, I want to thank Annalie for her expertise and her presentation of this material. Thank you again, Annalie, and thank you all for joining us today.